Good afternoon, folks. This afternoon's topic A is frontotemporal lobe disorders, or FTD. Okay, I'm going to explain those to you today for A. So let's go. Frontotemporal disorders, FTD, are brain diseases that primarily damage the frontal and temporal lobes, causing early changes in behavior, personality, and language, rather than early memory loss. There is no cure today, but symptom-focused care, safety planning, and early legal financial steps improve outcomes for patients and families. What is FTD? Frontotemporal disorders are a group of conditions in which neurons in the frontal and temporal lobes shrink and stop working, producing progressive changes in thinking, behavior, and language, and sometimes movement. FTD often appears between ages 45 and 65 and is a common cause of early onset dementia. Behavioral variant, FTD or BVFTD, early personality and social changes. Disinhibition, apathy, loss of empathy, compulsive acts. Primary progression, aphasia or PPA, passive language impairment, word finding, grammar, or loss of word meaning. FTD with motor features overlaps with movement disorders such as cortical basal syndrome, progressive spironal nuclear palsy, or ALS. Some people diagnosed and medical management. How it's diagnosed. Clinical history, neurologic exam, neuropsychological testing, brain imaging, MRI, PETs, scans, and sometimes genetic testing. There is currently no disease-modifying treatment. Care focuses on symptom management, behavioral strategies, speech therapy for PPA, targeted medications for specific symptoms. Practical care strategies for families and caregivers. Key considerations: routine and structure, reduce distress and confusion, simplify communication, short sentences, visual cues, yes and no choices for PPA, behavioral approaches, redirect rather than confront, remove triggers, use calm neutral responses. Safety planning, supervise finances, driving, and kitchen access early. Consider home adaptations and supervision as symptoms progress. Practical tools, use written schedules, labels, and step by step task cards. Start speech language therapy early for language decline. Keep a single trusted person handling legal and financial matters once capacity declines. Legal, financial, and emotional planning. Act early to complete advance directives, durable power of attorneys, and financial plans. While the person can participate, caregiver stress is common. Seek respite, counseling, and peer support. Resources and next steps. Authoritative patient booklet. Frontotemporal disorders. Information for patients, families, and caregivers. Offers detailed practical guidance and local resources lists. Frontotemporal dementia (FTD) primarily affects behavior, personality, and language rather than early memory. There's no cure, but early diagnosis, structured routines, and communication strategies, safety planning, and legal financial steps greatly improve quality of life for patients and families. What FTD is? Frontotemporal dementia is a group of disorders caused by degeneration of the frontal and temporal lobes, producing progressive changes in behavior, personality, and language, and sometimes movement. Onset is often between ages 40 and 65, and FTD is a leading cause of early onset dementia. Core clinical types: behavioral variant, FTD, BV-FTD, early changes in social conduct, disinhibition, apathy, loss of empathy, and compulsive behaviors. Primary progressive aphasia, PPA, progressive language impairment, non-influent speech, word finding, or loss of word meaning. FTD with motor features may overlap with movement disorders or ALS. Some people diagnosis and medical management. Diagnosis uses clinical history, neurologic exam, neuropsychological testing, and brain imaging. Genetic testing is offered when family history suggests inherited forms. There is no disease modifying therapy currently. Treatment focuses on symptom management, behavioral strategies, speech therapy for PPA, and targeted medications for specific symptoms. Practical care strategies for families. Key considerations and decision points. Routine and structure. Reduce agitation and confusion. Communication. Use short sentences, yes or no choices, visual cues, and allow extra response time for PPA. Behavioral management. Redirect rather than argue. Remove triggers. Set consistent boundaries. Consider psychiatric consultation for severe symptoms. Safety. Review driving, finances, and kitchen access early. Assign a trusted person for legal and financial decisions while capacity remains. Practical tools. Written schedules, labeled cupboards, and step-by-step task cards. Early referral to speech and language therapy for PPA. Respite and caregiver support to reduce burnout. Legal and financial and emotional planning. Act early to complete advanced directives, durable power of attorneys, and financial planning while the person can participate. Caregivers should seek counseling and peer support. Advocacy groups can help navigate benefits and services. Resource and next steps. National Institute on Aging / NINDS booklets, practical patient family guide, and local resource lists. Family Caregiver Alliance, symptom specific tips, and caregiver education. AARP, caregiver networks, family stories, advocacy, and practical programs. Risks and challenges. Major challenges include misdiagnosis, often mistaken for psychiatric illness, rapid relationship changes, and caregiver burnout. Plan proactively and prioritize safety and supports. Okay, guys, that's your A for today. I will be back on shortly with B. For now, Gator Wellness. Take care, folks.